Your Dog's Friend is a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. We promote positive method of training and behavior modification through stress-free methods. As part of that mission, we offer free webinars like the one you're about to watch. Subjects range from dog behavior, stress-free training, and other tools to help you understand your relationship with your dog. If you like the webinar, be sure to give us a thumbs up. Click the notification bell and subscribe to our channel. By subscribing, you'll be notified when future videos are posted. Now enjoy the webinar.
Welcome to today's webinar, Debunking Dog Training Myths, sponsored by Your Dog's Friend, a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. Since 2006, we've been promoting the use of positive dog training methods by hosting free webinars just like this one, posting valuable resources on our website, offering affordable training classes in person and online, and providing free advice and referrals. We are passionate about our mission, so we hope you will enjoy this webinar and spread the word about Your Dog's Friend. My name is Carrie Hoare, and I'm a volunteer with Your Dog's Friend, and I'll be your host for today's webinar. Our speaker today is Dr. Amy Pike. Dr. Pike is a veterinary behaviorist, one of about 100 in the United States, and is the co-owner of Animal Behavior Wellness Center with locations in Fairfax and Richmond, Virginia. Dr. Pike sees pets with various behavior disorders that range from mild fears to extreme aggression, compulsive disorders, and panic disorders. Dr. Pike works with a team of behavior professionals and is working to expand prevention services with her support staff, providing behavior and training classes and patient handling workshops for other veterinary professionals. So before we begin, let me remind you that Your Dog's Friend is a nonprofit. So if you find this webinar helpful, please consider making a donation. And with that, let's get started with today's webinar, and over to you, Dr. Pike.
All right, thanks, Carrie. So we are going to be talking about dog training myths and some of the most common things that I hear and see every single day in my practice. So what is the first myth that we're going to talk about? And it's the title of our lecture today. You can't teach an old dog new tricks. So what do I hear? What have I heard in the trenches? He's too old to learn anything new. She's too old to play or have fun. He's old, so he doesn't do much. But what is actually the truth? So age is not a disease. The older dogs are often more patient and less impulsive than young puppies, so it could actually be a lot easier to teach them new things. And what we find fun at each age is different for both humans and dogs. I used to ski when I was in veterinary school. I went to Colorado State. I do not ski anymore. I don't find it fun. Falling and potentially breaking my leg is not fun to me, so I'm not going to do that anymore. And dogs are no different. So what they did as a puppy may not necessarily be what they want to do as an adult. So you have to explore new things. And slowing down is not necessarily a normal part of aging. So dogs that are slowing down oftentimes have pain that is actually preventing them from doing their normal mobility. So it's really something that you want to talk to your veterinarian about. So how do we train older dogs if you can teach them new things? You want to adjust for their physical limitations. So you may need to keep your sessions shorter. If they are blind or deaf, you may need to switch to a visual or a verbal cue. You oftentimes need higher value, smellier rewards because we all lose our sense of smell as we get older. And so we have to make that reward a little bit stinkier. So one of our favorites to use with our older dogs is actually cat food because it's pretty darn stinky. And then if they're painful, you don't want them to do certain tasks or tricks. If I have a puppy, and I've seen trainers do this all the time, we do what we call puppy push-ups. So sit to a down, to a sit, to a down. You probably wouldn't want to do that with an older dog, especially ones with knee or hip issues. And so you're going to have to adjust how you're training with them. And you also want to adjust for cognitive limitations. So just like us, yes, we get cognitive decline as we get older. And just like us, there is a version of Alzheimer's. It's called cognitive dysfunction syndrome in dogs. And so we need to make sure that we adjust for those particular limitations. So you might need to do easier tasks. You might need to break the tasks or tricks up into smaller parts, sort of chunk it out a little bit smaller for them to learn that. Again, use those higher value, smellier rewards. And definitely keep at it lifelong. So if you've ever heard of the saying of use it or lose it, right? It's why we're supposed to do Sudoku or crossword puzzles as we get older, because it really does help our brain to, cognitively as we age. The same is true for dogs. So you should be training your dog new things all the time in order to actually help stave off cognitive decline. All right, so what's another myth? So dominance, the term dominance applies to the human-dog relationship. So what have I heard in the trenches? I need to dominate my dog in order for it to be well-behaved. I hear this all the time, unfortunately, or I need to be the alpha. Don't let your dog sleep on the bed or get on the furniture, or it will think it's higher in rank than you. My dogs sleep on the bed. You need to be the alpha or the leader of the pack. And unfortunately, a lot of dog training companies that use punishment-based aversive methods are named alpha or pack something. And dogs that are aggressive are just being dominant. You need to alpha roll the dog to show it who is boss. So what is the truth? So let's talk about what dominance is first. So dominance is a descriptive term that applies to a relationship between two individuals in a social group. It's not a global character description. That means one dog is not globally dominant over all other dogs or over the dogs in its household. It really is about the resource, and we'll talk about that at the end, but it can be very, very contextual. So in canids, so our dogs, the subordinate actually maintains the relationship by consistently deferring to the dominant. So if you've ever seen a dog group playing, you'll notice that some dogs will roll over on their backs, doing what we call a submissive body posture towards the other dog. It was not the dominant dog in that relationship that rolled the submissive. It was actually the subordinate that did it itself. And so it's actually the subordinate's job to maintain that sort of hierarchy there. And again, dominance may be contextual based on the resource at issue. So if we have, like in my house, I have a 105-pound giant schnauzer who is the oldest in our household. So a lot of people would think, oh, he must be the alpha of the bunch, and he is not. Number one, he is definitely alpha or dominant over tennis balls in this house. Nobody else better take one of his tennis balls. And they just all back off. They're willing to do that. They're like, yep, nope, I don't care as much about that resource as you do. I'm not willing to fight over it, okay? But when it comes to my attention as a resource, my Airedale is actually the dominant one. She probably would climb into my skin if I would let her. She adores me. And my giant, don't get me wrong, he adores me too, but he is willing to defer to her to say, gosh, you're a little bit nutty about that woman. I do like her, and she does feed me and train me and do all kinds of things, fun things with me, but you are way more into her than I am. And so when I am petting my giant schnauzer and my Airedale comes up, my giant schnauzer walks away. And he allows that to happen because he's like, I don't really care about that lady as much as you do. Okay. So, and what a lot of people describe as dominance is actually fear or frustration. So I hear a lot of times, like I just heard it this week from a client, her two dogs in her household are having conflict. And she mentioned that the younger one oftentimes will mount or hump the older dog. And she's like, well, I guess he's trying to be dominant. Actually, what the younger dog is trying to tell the older dog is that you are stressing me the heck out. Please stop what you're doing. And so actually many of these things that we sort of historically have equated with dominance are just fear or frustration. And a lot of our ethological research is trying to change the term dominance to more of a term of resource holding potential, meaning you care about that resource more, you're more willing to fight over that resource, and so therefore you have a higher resource holding potential than others. Now, what about interspecies dominance? So I hear this all the time. We talked about the dogs in the household, and yes, they will be dominant and submissive about certain resources. However, what about me and my dogs? Am I dominant over my dogs just because I am a human? Well, there is no animal in the entire animal kingdom that creates dominance hierarchies with other species. So if you go back to this, the term dominance, the definition, it's a descriptive term that applies to a relationship between two individuals in a social group. So it's among dogs, it's among cats. We, I think, have dominance and submission as well in humans, but it is not about what guides my relationship with my dogs or my dog's relationship with me. They are not out to dominate. So a lot of people blame dominance on, the reason that they can't train a dog. Oh, he's just so stubborn and dominant. So if that is not really what's happening here, what are keys to good behavior? Well, it's structure, predictability, and appropriate reinforcement. So animals, ourselves included, thrive off of structure and predictability. When we don't have structure and predictability, we get anxious, and anxiety inhibits learning. So we need that structure and that predictability to happen in order for the learning to happen. And then appropriate reinforcement. If you are appropriately reinforcing a behavior for a learner, you are going to get that behavior again in the future. So people will always talk to me about like the treats that they're using, and they're like, well, they won't do the trick for the treats. And I'm like, well, what treats are you using? And they're like, oh, the little milk bone dog biscuits. And I'm like, oh, that's kind of like cardboard in the dog world. Or like, they're like, oh, I'm just going to use their food for reinforcement. Well, that's fine for some things if it's easy or the dog already knows it. But if you want something new or a behavior that's really difficult, or an animal is really anxious and you need them to perform a behavior, you are going to need a higher value reinforcer. So it's like trying to train with salad or cheesecake. I am absolutely willing to clean a toilet if someone was going to bake me a cheesecake, right? But I am not willing to clean that toilet if they're just going to give me a salad. Not happening. So you need to make sure that you have the appropriate reinforcer. So if it's not dominance, then why would a dog actually misbehave? Well, number one, opportunity. Dogs are opportunists at the end of the day. And if I leave thawing steaks out on my counter and walk away and my giant schnauzer is in the kitchen, guess what? He has an opportunity to get some good steaks, right? That was my fault as the setting up the environment poorly for that dog to succeed. There might be distractions. So if you are an Airedale Terrier, training outside in my wooded backyard where there are tons of squirrels, not really the best setting for that, because she is going to be distracted by so many other things, right? Under training, so this is a term that I use. This is not something that is like used in the ecological literature, but if you have undertrained a behavior, that means that you really haven't proofed the behavior, meaning my dog learns to sit in my kitchen, right? That's where I'm training. I'm doing the sit, but then I move to the living room and I tell him to sit and he doesn't sit there. Well, why not? Well, we haven't trained there. You actually have to train that behavior in different environmental contexts and under different circumstances in order to make sure that you have proofed that behavior and that it will occur in other places. So it's really funny when people come to see me as a veterinary behaviorist. I think they assume that I kind of want to see like what tricks the dog knows. And so they will start, like, as soon as they come in, they're like, sit down, shake butt. And I'm like, okay, stop, first of all. But so often the dogs do not sit. They're not going to sit, right? They are stressed from being in a new environment. It smells potentially like a hospital. because it is a hospital. And the owner doesn't have their normal, treats on them, or, their training clothes, or whatever the case may be. So they're not going to do it. And so no matter how much training you've done in all these other places, doesn't mean that that's going to happen in a new place like that. Under motivation is huge, right? Like we talked about the cheesecake versus the salad. You absolutely need to make sure you have a high level of motivation for the reward. And then anxiety. So anxiety absolutely inhibits learning. I tell people this all the time. If you just had a death in the family, you are not going to be able to sit down and do Duolingo on your phone to learn Italian. It's not going to happen. Your brain is elsewhere. You are not in a cognitive frame of mind. You are using your amygdala, which is your emotional brain center, or your brainstem, which is your fight or flight. And so when an animal, or one of our dogs, is anxious as well, they're not going to be able to learn. All right, so what's our next myth? Misinterpretation of body language. This is huge. So what have I heard in the trenches? The dog bit out of nowhere. I would like to think that you guys can all look at this video, this picture, and realize that this dog, if it bites this little girl, this is not out of nowhere. We'll talk about why. He knows he did wrong. See, he looks guilty. This poor little Frenchie does look to many people like he is guilty. And it says, I ripped the nose off of every toy I own, including these hedgehogs, forcing my mom to continually sew their faces shut again. I don't think this guy feels any amount of guilt, or he wouldn't do it. He loves to rip the eyes off the hedgehogs, right? Or the nose off the hedgehogs. So that is not guilt. She does, quote, just fine at the vet. And obviously, I know this is a kitty cat, but cats are pretty notorious for this behavior that we'll talk about. He wants his belly rub. Well, she's wagging her tail, so she must be happy to see me. I think you can probably see that this dog is wagging its tail. This dog is not happy to see whoever is taking that picture. He approached me to be petted, so why did he bite when I did? All right, so what is the truth about all these myths? So body language is obviously very nonverbal, but dogs and cats in general are incredibly nonverbal. So they give a ton of signals that we often miss, that actually are telling us they are uncomfortable way before we actually have to, quote unquote, make them raise their voice. So if this has escalated to me hearing a dog growl or a cat hiss or growl, if you've ever heard a cat growl, it is really awful sounding. That is a really high level of aggression, which means that we have pushed that animal way too far because we've missed all of their nonverbal signals. So for dogs, when it comes to body postures, we can see offensive and defensive body language when we're talking about fear. So, but it is all still fear. And what this depends on is many things. So you can see the dog on the left. This is our offensively aggressive or offensively fearful dog. So the dog is very big, tall. You can see those hackles are raised. The tail is up and highly aroused. And you can see those ears are forward. His body is completely forward. Whereas the dog on the right is our defensive body posture. So he is crouched down. His tail is tucked. Those hackles are still raised. The ears are back. Some of the similar things in the face there, but both of these dogs are fearful. So what makes a dog show the body language on the left versus the body language on the right? That can be learning. So if they learned when they gave defensive signals that didn't work, it didn't actually cause whatever was scaring them to back off, then they might say, well, that didn't work. So then they go to offensive. There can be breed predispositions. My giant schnauzer is not going to show defensive aggression. He is absolutely going to show offensive aggression because that's what they were bred for. They were bred to be guard dogs, right? And so that is their MO. Bark first, ask questions later, basically. It can be that the trigger or the thing that's stressing them out is coming at them really, really fast. So they may feel like they don't have the opportunity to give those defensive body signals first, and they go straight to offense. So there's all kinds of things that kind of play into whether a dog is going to be offensive or defensive. Another one that's really common is whether the animal is in their own territory or outside of their territory. So a dog that is inside their own territory is most often going to be offensive in nature because that's their safe space. That's where they feel the most comfortable, right? Whereas you take them to the vet clinic and we take them into the back room and they may be not able or feel like they're not able to use offensive strategies. And so they are terrified and shutting down and slinking down and becoming defensive because they are not in their safe space or with their safe people. All right. Some of you have seen this before in many of my lectures. This is called the canine ladder of aggression. And so these are body signals that a dog would give to another dog. And since they only speak dog, would also give to a human to say, I'm stressed, please stop what you're doing, please back off, or else I'm going to have to escalate, right? So your green, yellow, and orange signals, people, I guess we used to call them submissive. Some people still do call them submissive. I don't like that term because I don't really think it's capturing what's actually trying to happen here. I like either disengagement or appeasement. So the animal is trying to disengage from what's stressing it out, like please stay away, basically, or trying to appease what is stressing it out so that it will back off. Okay. So things that you'll see, yawning, blinking, rapid eye blinks, nose licking, turning their head away. That's where you get the whale eye, where you can see the whites of their eyes, turning their body away, sitting and pawing. And this is not a paw of like, pet me, pet me, pet me. This is a paw of stay away. It's like more of like a little, like I raise my foot kind of thing. They may try and walk away if they have the capability. They are creeping. They have that defensive body language. Their ears are pinned back. They're standing crouched. Their tail is tucked under. The lying down leg up, which we will talk about in a second. And then if those aren't heeded, those warning signals are not heeded, they may start to get into the dark orange and red. And that's stiffening up, staring, growling, snapping, and biting. So when we say don't make the animal raise its voice, this is what we're talking about. Listen to those early warning signals that says, I am uncomfortable here. Please stop what you're doing. All right, so if there were truly no warning signals, and I hear this from clients all the time, like there was no warning whatsoever, it could again be the speed at which the stressor is coming towards the dog, the distance that you are towards the dog. So if I am a veterinarian in an exam room that is 20 feet in length, which is like our main consultation rooms, versus 5 feet in length, which is pretty typical veterinary exam room size, then there's not going to be very much distance between the dog and what is stressing it out, me. So they may feel like they can't give any warning signals because they don't have the ability, because I'm going to be able to cross that distance pretty darn quick. The ability to flee. So one thing that I see very commonly is dogs that are reactive on leash, but not when they're in like a daycare setting. And why is that? Because when they are attached to a leash to their owner, they can't flee. They have that 5-foot lead or 6-foot lead that is keeping them right where they are. Whereas in a daycare or a dog park, they can leave the situation if they need to, right? You're making me uncomfortable. I'm going to wander over here instead. And then we talked about learning history. So if the early warning signals didn't work, then we have to escalate. But also if any of those early warning signals were punished away. So we see this really commonly with clients who have gone to aversive trainers, is the trainer shocks the dog or uses the prong or the choke collar for leash corrections when the dog growls or lunges or snarls. Well, if I've just taken growled, lunging, and snarled away from that learner, they're not allowed to do that anymore. What am I left with? It's a bite. So we don't ever want to punish early warning signals because that is our dog trying to tell us there is a problem. We actually want to appreciate, and I tell my clients, tell your dog thank you when it growls at you, because I don't want it to do anything else. If he is that uncomfortable and he's growling, I'm going to say thank you and oh my gosh, how can I make this better for you, right? I don't want to get rid of the growl. If I get rid of and punish that growl away, that's like taking the batteries out of your fire alarm. You need the fire alarm to tell you there's a fire, right? So don't ever punish the growl. So the spectrum of fear, and this applies to our patients that, or our pets that do quote unquote fine in certain circumstances, and they're not actually fine. So you take your dog to the groomer, drop it off. They're trembling, they're shaking, they're terrified walking into the groomer. The groomer takes them away from you, and then you come back, 4 or 5 hours later and you say, how did they do? And the groomer says, they did fine. It's probably because they completely shut down. So fear is very much a spectrum, all the way from frozen, we call that learned helplessness, to aggression. And anytime you are fearful, you can be anywhere on that spectrum. And it can depend on what's happening, what the trigger is, who you're with at the time that the trigger appears. So when we take patients as veterinarians into the scary back room where we do our treatments, oftentimes those patients, if they were lunging, barking, and growling at us in the exam room when mom and dad was in the room, we take them away from mom and dad, which is their safety net, they freeze. And so they are, quote, better when we take them away from you guys. However, that doesn't mean that they're any less fearful. In fact, I actually think they're probably more fearful, because at least when you're using aggression, you have a behavioral strategy. When you have gone to learned helplessness, that means I don't have anything else. I'm just going to shut down and take it, basically. And it is not because they are guarding their owners. So I hear this actually from my colleagues a lot, is they'll say, oh, well, they're resource guarding the mom or the dad. And so when I take them away, they're not resource guarding anymore. They're not. They are guarding themselves. It is very, very selfish of them, but it is not about the owner. It is about them and their stress. And so they're using aggression as a behavioral strategy. So when we take them into the back and they are, quote, fine, that doesn't actually mean that they are fine. All right, the rub my belly conundrum. So I showed this dog. This is actually the body posture back in the ladder of aggression that I said is the lying down, leg up. So if you look at the whole dog, you can see that this dog is squinting, could have just been blinking, obviously, since it is a picture, but its ears are back. Its tail is tucked tightly under. This is a female dog, not a male, so that is its tail. Their leg is pulled up. That is that disengagement paw thing. And then it's showing its abdomen with its back legs. Basically, what this dog is saying is, here's the most vulnerable part of me, my abdomen. It has no protection, barely any muscle and skin in there, no bones to speak of. And that is really vulnerable. That means I mean you no harm, but if you don't back up, I'm going to escalate. And so this is actually one of the very last body postures before aggression. So when I was in general practice, so many times I would walk into exam rooms and the dog would lie down and show me its belly, just like this. And the owners were like, oh my God, that's so sweet. He wants you to rub his belly. No, he does not. He's actually asking me to head back out that door because I am stressing it out. Okay, so this is not a belly rub invitation. This is a belly rub invitation. So do you see the difference? The dog, rather than being on its side, is on its back, on its spine. Its tail is not tucked. It's nice and neutral and relaxed. Those front legs are kind of splayed open even, and its tongue is lolling off to the side because it is so happy to have its belly rubbed. So the dog on the left, no way. The dog on the right, yes, that is an invitation. All right, so some of the body language resources that are out there. Brenda Aloff has a very, very good photographic guide to canine body language. It's a very dense book, but lots of great things if you're interested in sort of a higher level of understanding of canine body language. Lily Chin, who is amazing. She is a fabulous artist out of California. She has her website called doggydrawings.net and /educational, where you can find all of her drawings where she depicts various body languages for dogs, cats. She's got hedgehogs, and I think she's working on horses right now. The late Dr. Sophia Yin also has a wonderful website, drsophiayin.com, where many of Lily's drawings actually are featured and talking about body language. If you're interested in cat body language, Purina has a really good website there to understanding your cat. And Vet Changes the World blog has a great sort of blog on reading animal body language. All right, so what is our next myth? All right, so psychotropic medications. So the bread and butter of what I do as a veterinary behaviorist. Essentially, I am a veterinary psychiatrist. So I am the equivalent of an MD psychiatrist. I have done my DVM degree, and I have done a residency in psychiatric behavioral medicine for companion animals. And so we do a lot of prescribing, but I hear a lot of myths about psychotropic medications. So what have I heard in the trenches? Acepromazine is great for storms, car rides, and vet visits. Acepromazine is a very old medication. We'll talk a little bit more about it, but it was around when I came out of school, and we called it the little yellow pill because they're all yellow. And every year during thunderstorm season in Arizona, where I was practicing, everybody came in for their little yellow pill because that's how they knew it too. That or ACE is what clients call it. So, but we now know that this is not a very good medication. Owners don't want the Prozac. I don't want my drug to be, or my dog to be drugged or make him a zombie with these meds. And meds should absolutely be a last resort. I hear that all the time from clients, like, ooh, I don't want meds. Those are a last resort for me. Or I hear a trainer can handle any behavior problem. And so in other words, why would I refer to a veterinary behaviorist, a veterinary psychiatrist? So what is actually the truth? So one of my colleagues, Dr. Karen Overall, is famous for saying, don't ace the fear. So acepromazine is not truly a good anti-anxiety medication. It's what we call a neuroleptic tranquilizer, which means it tranquilizes the nerves. It causes profound sedation. It causes muscle paralysis. And animals can be more noise sensitive on it, and aggression absolutely can increase. And one of my other colleagues, Dr. Alana Reisner out of Penn, calls ACE a chemical straitjacket. Because basically what you have done is you have sedated and paralyzed this patient. You've literally made them a zombie, but the fear is still occurring in their brain. So nothing has happened to help alleviate that fear. So that would be like putting me in a room full of spiders. I am terrified of spiders. And putting me in a straitjacket. That would be awful. I could imagine that I probably won't be less scared of spiders by the end of that experience. And I actually may die of a heart attack. Like, that's how bad my fear of spiders is. But for our patients, they are going to be worse every single time we give them acepromazine, because they're not actually learning that things aren't so scary. They're learning that they don't have any recourse to help with their fears. And so we don't want to use acepromazine alone. We use a lot of ACE in clinical settings. So ACE is a good sedative. It's a great sedative. We use it, the injectable version, in almost every sort of cocktail that we give to dogs undergoing anesthesia. So because we need sedation for that, but we're not using it for its anti-anxiety properties. And if you've ever heard of the chill protocol, which came out of Tufts and one of my colleagues, it does include acepromazine in that protocol, but it also has gabapentin, which is an anti-anxiety medication, melatonin, which can also have anti-anxiety properties. And so the ACE is used for the sedation factor, not for trying to help the fear. All right, so all those zombie dogs that I create, thousands upon thousands of dogs out there running around with their, Reconcile or Prozac prescriptions, acting like zombies. So the thing about anti-anxiety medications is that they are not sedatives. ACE is a sedative. It's not an anti-anxiety medication. We're not using it for its anti-anxiety purposes. But Prozac, Zoloft, Effexor, all of those medications, they are targeting the anxiety itself. They're targeting specific neurotransmitters to help with anxiety. So most often serotonin. Serotonin is our coping neurotransmitter. It allows us to have more cognitive thought when we are triggered by something stressful. We also target norepinephrine, which is adrenaline, and adrenaline is the fuel to that fight or flight mechanism. We target GABA, which is our inhibitory neurotransmitter, meaning it helps to dampen anxiety symptoms. And then we also target dopamine, and dopamine is our pleasure neurotransmitter, but it's also our bravery neurotransmitter. So it helps to give us a little bit of bravery in the face of our fears. If we start a medication with a patient, a daily medication, so I'm talking about the ones you have to take every single day, not the as needed, trazodone, gabapentin, clonidine, things that we would use for vet visits or car rides, something like that. If a patient taking a daily medication is lethargic, we would switch their medication. Does it happen? Absolutely. Humans, it happens all the time. But if you are lethargic, that's not quality of life, and that's not a quality of life for our pets either. So we want to make sure that if they are sedate, we would switch their medication. Every time that we try a medication, whether they have good effects, bad effects, or no effects, because that can happen too, unfortunately, it does give me information about what we should and should not use in the future. So that tells me, okay, if this patient is sedate or lethargic on Prozac, oftentimes they do better with sertraline, which is Zoloft. So it gives me information about what I should use or shouldn't use, what I should avoid, because all of these do target their specific neurotransmitters, but also they target different subreceptors of those neurotransmitters as well. And that's all that years of schooling that I went to figure all that out. So that's why that gives me information. Now, I will say one of the things that owners report is that, hey, doc, they're sleeping more. Are they lethargic? That's not lethargy. Lethargy means you cannot rise from sleeping. You are stumbling when you're walking. You are hypersomnolent, meaning you are falling asleep all the time, even when you're doing things like eating or going for a walk, playing with a ball, something like that. However, animals that are less hypervigilant, and hypervigilant means I'm attuned to everything in my environment. I heard a noise, I pop up at the moment's notice. A leaf blew outside, I'm running to the window barking. That's hypervigilance, that's anxiety. And when we relieve that hypervigilance, you sleep more normally. So dogs actually rest or sleep 20 out of 24 hours a day. That's a lot of hours. And even working dogs, guys, not even our Malinois, our Border Collies, our Aussies, they rest or sleep that amount of time too. So if you have a pet or a patient that is not getting that amount of rest or sleep per day, they are likely anxious. So all right, so what about medication as a last resort? And I apologize, my headphones keep slipping off my head. So medication as a last resort, number one, it should never be a last resort, in my opinion, because practice makes perfect with these behaviors. So when it comes to behavior, you perform a behavior, it gets reinforced every single time or punished potentially, but learning happens. All right, the Amazon delivery truck comes to my house, I bark, he runs away after he's rung the doorbell. Yay me, I barked the Amazon guy away. Next day he comes, what the heck, you didn't listen to me yesterday. All right, I gotta bark you away again because I got reinforced for that behavior. It worked yesterday, right? And so I'm going to do it again. If your animal or your pet or your patient is not able to learn that these things are not so scary, they are not going to actually be able to learn other tasks, other things that they can do. So instead of barking at the mailman or the Amazon guy, what do I want you to do instead? All right, a little raise your head woof to tell me someone's here, that's fine. But otherwise, I want you to come lay down on your dog bed, right? So early intervention is going to be key for if there is anxiety driving this behavior, because every single time they do it, they're going to get reinforced or punished for it. And we want to put the kibosh on that learning. And the same is true even for puppies and kittens. So I have medicated dogs as young as 6 weeks of age. And the reason is because they were abnormal. Their brains were not functioning normally. A 6, 7, 8-week-old puppy should be gregarious, social, playful, exploratory. But when you have a puppy that is showing aggression, that's not normal at that age. Showing extreme anxiety, also not normal at that age, or completely shut down and shy, not normal at that age. They need intervention. We do not grow out of our anxiety, we grow into it. And I tell people this all the time. So just saying, oh, it's just a puppy, it'll grow out of it, that's not what happens. It actually gets worse, because you also have learning that's taking place all the time, right? And so that's happening. We have different developmental periods that the dog is going to have to go through. So that 6-week-old puppy that I saw is going to have to go through a primary fear period after the socialization window ends around 14 weeks of age. They're also going to go through a secondary fear period around 9 or 10 months of age. And so I need to intervene now when I have the best chance of actually changing things in the brain that I want changed. So when you are born with something like millions more, thousands, maybe millions more neurons than you actually need. And as we get older, until we reach adulthood, which for a dog is about age 3 or so, we are doing what we call in the medical field neuronal pruning. What that means is we're basically getting rid of those neurons. We're getting rid of them. And by the time we are an adult and our brain is solidified, that's what we have. It is what you got at that point. So if I am able to intervene before we prune all those neurons and actually affect good change in the ones that are going to stay, I am going to have the best chance of success, and also actually the best chance of ability to get that animal off of medication. So the sooner we put an animal on meds, the sooner you could potentially get them off of medication as well. So if that's ever a goal for an owner, we definitely want to make sure that we intervene soon. Okay, so any qualified trainer can treat a behavior disorder. Now, don't get me wrong, there are amazing trainers out there, and there are trainers that are way better trainers than I am. But only veterinarians can diagnose, prescribe, and treat. And fear, anxiety, stress, and aggression are medical until proven otherwise. So whenever we have a change of behavior and no trauma incident to speak of, like a firecracker didn't go off next to the dog and it starts to become noise phobic, it's pretty obvious. That's a behavioral thing, right? But if the animal is fine one day and the next day starts to show noise phobia, that's medical. Something is going on. And actually, we know that pain is one of the biggest contributors to behavior change that is very, very unrecognized, even by my colleagues as veterinarians. So noise phobias has been shown to increase when we have pain going on. So definitely want to, number one, anytime that there's a behavior change, you want to seek care from your veterinarian. Make sure that there's not something medical that we're missing, and that this behavior change is the only symptom of. And then if you have ruled everything out and the fear, anxiety, stress, and aggression still remains, that is an emotional disorder. That is something that can be treated with medication. Now, it's medication plus behavior modification. It is never just Prozac. It is Prozac plus BMOD, as we call it, which is why I have a whole team. It's not just me. I have trainers, I have nurses, we are all in this together because it takes everybody helping this patient. If you are applying appropriately applied and appropriately reinforced behavior modification and you're spinning your wheels, nothing is getting better. It's not working. The BMOD is not, it's not helping. There's a reason why, and that's because the fear, anxiety, and stress is too high, and the animal needs medication in order to learn. So don't just try and train something away for 8-10 months. That you are literally spinning your wheels. If you have made serious effort and appropriately applied behavior modification for about 6 to 8 weeks, and you're not starting to see behavior change, there's something inhibiting that learning, and that's fear, anxiety, and stress. All right, so what is our next myth? So training myths. What have I heard in the trenches? Puppies should not go anywhere until they've received all of their vaccines. These poor little babies, shouldn't get parvo or distemper, so we need them not to go anywhere. Excuse me. If I give my dog a treat for getting off of the couch, that just encourages him to get on in the first place, right? Giving an aggressive dog treats just encourages him to be more aggressive. He knows the difference between right and wrong. So I hear this all the time, like he knows the difference. And if I use treats to train, I will always need them to get the dog to behave. You shouldn't use punishment because it just isn't effective. And a trainer is a trainer is a trainer. So what is the truth? So puppies and kittens, and I mentioned this earlier, go through a socialization period. For kittens, it's from about 2 or 3 weeks of age to about 8 or 9 weeks of age. So very, very short window. And for dogs, it's about 3 weeks to about 14 or 16 weeks, depending on the dog breed and also the researcher that you talk to. So this window of opportunity, often people call the sensitive period, because it's when dogs and cats are the most sensitive to new experiences, new sights, new sounds, new smells, everything that they're going to experience in their environment later. And they need to experience those things before that window closes, or else those things can be really scary later on. So most vaccination series are not completed until about 16 weeks of age. That's when you're old enough to get your rabies vaccine, and most often you get your last distemper parvo vaccine. And so if a veterinarian is unfortunately telling you to not take your dog or cat anywhere before they get all their vaccinations, they are essentially eliminating this socialization period. So everything that the dog is going to experience out in the world, it's not getting those experiences early on, and we can't make those positive. So that dog is going to be much more fearful, much more prone to aggression. So socialization, a lot of my colleagues like to think of this as like vaccination for behavior problems. So if we appropriately socialize animals, we have the most chance of success of getting an animal that is behaviorally normal later on. And that needs to happen before that socialization period ends. So 2 of my colleagues, Meredith Stepita and Melissa Bain, did a study looking at the frequency of parvovirus in vaccinated puppies that attended a puppy socialization class. So this was published. It's an older article. I think it was 2005 or 6 maybe. And so what they looked at was puppies that already had 1 vaccine under their belts that went to socialization class. Did those puppies have a higher chance of getting parvo versus those that did not attend socialization classes? And what they found was the puppies that attended socialization classes were no more likely to get parvovirus than the puppies that didn't attend socialization class. In fact, I think in their study, 0 puppies that attended socialization class were diagnosed with parvovirus infection. And 1 puppy that didn't attend socialization class did get parvovirus infection. So you are not going to put these animals at risk if it is an appropriately run, appropriately cleaned facility and appropriately run class where they ensure that the puppies have had at least 1 vaccine and that the puppy cannot start class before or within 10 days of the owner obtaining the dog. And that 10-day window is for the purpose of the incubation period for parvo. So if an owner picks up a dog on day 0 and it has parvo, they're not going to know it until symptoms happen about day 4 or 5. But if they go to class before that, that's not good, right? Because they're still shedding that virus in their poop. So we want to make sure that we wait the incubation period, which is about 5 to 10 days, so that if they are showing any sort of symptoms, they can go get seen by their veterinarian and get tested before they would actually start class. So we run puppy socialization classes in our practice, and we had something happen for the very first time ever the other day. We had a puppy that did come down with parvo. And of course, I freaked out. I was really nervous, but I was like, I think my trainers were actually way more freaked out than I was. And I was like, look, we make sure that everybody else is vaccinated. We use cleaning chemicals that are used in veterinary clinics that do kill parvovirus. So every time a dog poops or pees, the area gets cleaned up with that type of cleaner. And nobody else in the class got parvo. So, you know, that was testament to how you can go to a very well-run class and not get this disease, even if another puppy there has it. So, and then the AVMA, which is our American Veterinary Medical Association, has what we call a white paper out on the socialization of puppies and kittens, and basically a literature review on all the welfare implications of lack of socialization. And their stance is in agreement with the American College of Veterinary Behaviorists, is that puppies and kittens need to have appropriate socialization before that window closes. So if I give a dog a treat for getting off the couch, that's just going to encourage it to get on the couch, right? Not really. So there are some dogs that can chain things together. I jump on the couch, mom says, get off, I get a treat. Okay, great. I've chained that together. But if you are teaching the dog what to do instead of being on the couch, I want you to lie in your dog bed, right? If you don't want your dog on the couch, give it someplace nice and cozy to lie instead, and teach the dog that that is the most rewardable spot to be in the house, not on the couch. If I have a dog that jumps on visitors when they come over, well, he can't jump on visitors if 4 paws are on the floor or he's, standing or sitting. So if I don't want him to jump on visitors, I need to teach him what I want him to do instead, and that's to sit. And that's got to be the most rewardable thing. For the most majority of dogs, if you give them a treat for getting off the couch, the only thing that you're going to do is reward them for complying with the cue of off or the request to get off of the couch. Most dogs are not going to chain those things together for the most part. So don't worry about trying doing that. Oh, so giving an aggressive dog a treat just teaches him to be more aggressive. If my dog is lunging at another dog and I stick hot dogs in front of his nose to, get his little attention there, is that just going to mean that he's just going to keep lunging more? No. What that is actually going to do is teach him you don't need to be so darn fearful of those other dogs. If you think about it, this is very, very basic and not, learning theory, PhD level in terms of explanation. But if you think about somebody comes to the door and chicken rains from the sky, every time someone comes in the house, the dog's probably going to be like, bring on the people, right? Because chicken rains from the sky. I love it. So you don't need to worry about encouraging that behavior of barking, growling, lunging, etc., because what you're trying to do is actually counter condition or change that emotion for them. Oh yeah, dogs are amoral, so they don't know right from wrong. All they know is do or do not do. So the dog wants to get what he likes, and he's going to try and avoid what he doesn't like. So that's where reinforcement and punishment come into play of behavior change. And we're not going to go into that, but my dog is not doing something to be, he knows it's wrong. So, and he's doing it to be, spiteful towards me. The dogs are not that smart. They don't have that higher cognitive capacity that we do. All right, so I'm always going to need treats in order to train a behavior. No, actually, that is not true. So you will need treats initially to train a behavior, but then once a dog or a cat or a human knows a behavior, we actually want you to fade those treats out to an intermittent reinforcement principle. So intermittent reinforcement is the slot machine principle. I pull that lever on the slot machine, and sometimes I get the jackpot. Sometimes I don't get anything. Sometimes I lose everything that I put in, but I'm going to keep pulling that lever because sometimes I do get that jackpot, right? It's actually why gambling is so addictive, is because of the intermittent reinforcement principle. So when we fade treats out, you aren't going to need them all the time. And animals are very attuned to environmental conditions. So if my dog doesn't sit in the kitchen, it's because I didn't train it in the kitchen, right? I didn't train it. I trained it in the living room or whatever. The other thing that animals become very attuned to is, I have owners say, like, he'll only do it when I have treats. Well, yeah, if you're showing him the treats every time, he's going to learn that I'm only going to get rewarded when she shows me those treats. It's why we often put treats in a treat pouch. And I like to actually put that treat pouch behind me so the dog doesn't even see it, or I'll put treats in my pocket. It's also why I don't necessarily like to show my clicker. I like to hide it as much as possible because I want my dog to think, ooh, treats might be in that pocket. So I'm going to do that behavior, right? Because the jackpot might happen. I'm going to skip this for the most part, but the thing about punishment that you need to know is that versus treats that we do fade out, punishment actually does have to happen every single time the behavior is performed in order to work. So what you're not going to be able to do is ever have that shock collar off that dog or ever have that prong collar off that dog, because they're going to learn that I only have to not do this behavior when that's happening or when that's there, right? The thing about punishment is only teaches the dog what not to do, doesn't teach them what you want them actually to do. And it absolutely increases fear and anxiety, which is the last thing that we would want to do to any animal, in my opinion, but definitely one that has fear and anxiety as an underlying diagnosis. And it also puts the user at risk for aggression. So one of my colleagues, Megan Heron, did a paper looking at owners that had used punishment techniques in the past, and they were significantly more likely to have been aggressed upon by their dog. So how do we choose a trainer? So you definitely want to make sure that they don't use any punishment, aversives, corrections, compulsion, or they are balanced. Balance means that they use both positive reinforcement and other learning theory sort of arms of the contingencies. You want to attend a class, see what you see. Are dogs on prong collars? Are they on shock collars? Are they, are owners told to jerk and snap the leash, that kind of thing? Get a recommendation from your veterinarian or from a trusted friend. Research certifications. So there is no licensing body or global licensing body, I would say, or regulation in the dog training industry. So you don't have to have a certification, but those that do and have gone through continuing education and the process of getting certified, those are going to be better trainers. Make sure that they get continuing education. You would never want to go to a neurologist that graduated in 1980 and has not done any continuing education since, right? Same thing is true with your trainer. When I graduated from veterinary school, our veterinary behaviorists were recommending prong collars, a technique called nothing in life is free, which is a really, really antiquated method of withholding food. They're also recommending alpha rolling. Things change. The science has changed. We know that things now that we didn't know then. And had I not attended continuing education, because of course I love behavior, but also I'm required to as a veterinarian, then I would never know that. Okay. And the number one thing is don't fall for a guarantee. So if they offer like a lifetime guarantee on training, run the other way, because there's no guarantees when it comes to behavior. These are not robots, these are animals, and they're emotional beings. And always remember that you can teach an old dog new tricks. And I wanted to throw this out there for those of you who don't know. My business partner, Amy Learn, and I have a podcast. It's called The Behavior Buzz with two Amy's. And we talk about everything veterinary and behavior on this podcast. And it's a really fun way to learn about different aspects of the dog training industry, the veterinary world, and just have some fun with some fun ladies. So with that, I'm going to turn it over to Carrie for the questions.
So one comment at the beginning with regards to dominance.
Yes.
Mark noted that I've read that the alpha idea is outdated and was based on 50-year-old data collected on captive wolves, and what researchers now know is alpha is just the dad of the pack, because most wild wolf packs are offspring.
You are absolutely correct. Wolves are a familial unit, not a pack. And dogs are not pack animals. So even though our dogs share a common descendant or share a common ancestor with wolves, they are not wolves. And they are actually not pack animals either, but they have preferences in their social groups, right? They will choose to hang out with who they want to, and it's the same thing with us. Like I choose to hang out with who I want to. It is not because they're pack animals. And some dogs don't want any dog friends at all. So yes, you are exactly right about that old research.
So I've got a question from Angel about Clomicalm. Can Clomicalm make a pet more easily startled? I have a cat and a dog on it, and they both seem to be more easily startled.
Yeah, so any of our psychotropic medications can have what we call a paradoxical reaction. And a paradoxical reaction means that they are more anxious versus less. So you'll definitely want to talk to your veterinarian or whoever or a veterinary behaviorist that prescribed the Clomicalm, because there are other medications out there. And if they're startling more easily, that's not the right medication for them.
What if the fear issue relates to administration of medication and pill pockets, peanut butter, marshmallows, etc., for disguising the pill no longer works?
That is a great question. So eating or taking pills is a behavior that you can actually train. So you definitely want to find a qualified trainer that can help you with this and teach your pet to accept being medicated. And this applies to cats too. We work a lot with cats to accept pills, because getting a cat to take something is very, very difficult, way more than dogs. So definitely get with a trainer and teach them how to accept being medicated.
Here's another good question. How do you deal with clients being swayed by the allure of social media trainers who do the quick fix?
Oh, that's such a great question. Yes, we just have to keep educating. So education is going to be what gets us out of the dark ages, and spread the word, listen to podcasts, listen to the positive reinforcement trainers that are on social media. Instinct dog training is on there. Zach George is on there. All of the good ones are out there trying to fight the good fight. So just it's an uphill battle, but we can do it.
What are your thoughts on using things like Adaptil for noise sensitive dogs?
Yeah, Adaptil, so that's a pheromone product. So it's the maternal appeasing pheromone that mother dogs produce when they're nursing their puppies. And it can absolutely be used for many different things: noise phobias, separation related behavior, generalized anxiety. So the pheromones can be very, very applicable to many things. Now, there are some cases that are just way too severe that pheromones are not going to help, but it's always worth a shot to try, because you just never know when it might.
I have a question regarding that.
Yeah.
Do you know much about the ingredients in Adaptil versus, is it ZenDog, the new one that's out?
Yeah, ZenDog. So they're the exact same thing. It's the maternal appeasing pheromone. So when that pheromone came off patent, other companies were able to use it. So.
Okay. Do you see any difference between collars, diffusers, and sprays?
That is a great question. So I find an individual difference, not really like a product difference. So like some animals really, really respond well to the spray. Others do better with a collar, and others do great with a diffuser. So, and you can't overdose on the pheromones. So I always say just try them all, honestly.
Yeah. Yeah, you can always try something else if it doesn't work, but it's always
Exactly.
worth a try.
Exactly.
Okay, we've got one more question. I've heard that Adaptil is better for puppies, but it seems to make a difference for my 2.5-year-old. Do you see it helping older dogs or working better in
Absolutely.
puppies?
No, it absolutely can help all of the above. So the research is strongest on puppies, but anecdotally, I've seen it help with seniors with cognitive dysfunction that are anxious because of it. So use it.
All right, so here's a good one from a certified professional dog trainer who works with dogs, including reactivity. What tips do you have for clients to trust the process, that it will take time and consistency, but they just don't want to put in the work? Any words of wisdom?
Oh gosh, yes. That whole practice makes perfect thing. And I use a lot of analogies from human world. So, myself, I've probably been on a diet my entire adult life. And so, it didn't take me 2 months to get to this weight. It's not going to take me 2 months to get out of this weight either. And so that's kind of the same thing. If this is a new behavior, we're going to have so much better chance of treating that and changing that quickly. But if they've been practicing it for 7 years, it's not going to take, 7 sessions. It's going to take multiple. But again, don't forget to, if they're spinning their wheels and they're actually doing the work, you're putting in the appropriate, BMOD for them and they're doing the work, then they need medication to help facilitate that process too.
Next question. My dog is on sertraline and we are thinking about moving to Reconcile as her dog reactivity hasn't improved much despite months of BMOD, although sound sensitivity has improved.
Nice.
Do you often see major differences in side effects between these two drugs?
Yeah, so but again, it's an individual thing. So the number one side effects with Reconcile tend to be GI, so vomiting, diarrhea, or appetite suppression. Whereas sertraline does tend to be pretty easy on the appetite, pretty easy on the gut system, but it can actually cause hyperactivity in some dogs. So it's very individual. So it's always worth a shot if you are not seeing good effects, or at least as much beneficial effect as you should be at this point on the sertraline. It's well worth trying another SSRI.
Okay, one last question. How do you suggest we assess whether a dog care provider understands the principles we've talked about today? It's so hard to find groomers, sitters, etc. that
No.
get it.
Yeah, no kidding. Go to fearfreepets.com, not .org, I think, .com. And you can actually find fear-free certified professionals that are certified to understand and the emotional side of things. And Fear-free certifies groomers, they certify boarding facilities, they have a shelter certification, they certify veterinary professionals, and so there's lots of opportunities out there to find someone who totally understands.
Excellent. Dr. Pike, so thank you
Yeah,
again so much for
thank
presenting.
you.
Your webinars are always so good.
Oh, thank you. Appreciate
Everybody
that.
who joined us today, thank you so much for joining us. Then thanks again, Dr. Pike.
Yeah, you're welcome. Thank you, everyone.